Hey everyone, my name is Dr. Karthik Iyer, and I'm with Residency Medical and providing you with another high-yield case today. We'll start with a 27-year-old female who has just presented from a single vehicle car accident in the emergency department. She has only suffered minor cuts and bruises from the accident, so it's not a big deal, but she's been saying that she's been having trouble seeing to the sides lately. And on top of that, for the past few weeks, she's been having headaches that have been waking her up in the morning. Only thing she takes is an oral contraceptive pill, and she has no previous medical history. An MRI is given to you to help you with the diagnosis. What do you think the answer to this case is, and how do you treat it? Comment your diagnosis below, like the page, and follow for more information. Come back tomorrow, and you'll find out the diagnosis and some high-yield information about the diagnosis. What did you think it was? Did you get it right? So the answer is prolactinoma. This is a tumor that secretes prolactin in your pituitary gland. And there's a lot of different things that are very high yield about this case. One is that this prolactinoma is actually inhibited by the hypothalamus with dopamine. So the way to treat it is to give more dopamine, which will block the prolactin secretion. So the main treatment, whether it's a small prolactinoma or a huge prolactinoma, is to give a dopamine agonist, which is going to act like dopamine and inhibit prolactin. You also are probably wondering, why was the vision all messed up? What was going on? And the reason why is that the pituitary is actually located really close to the optic chiasm. And that's actually where the visual pathways go through, so you can see what you see every day. So because of that, when you block the optic chiasm, the lateral visual fields are impacted, so you only see your medial visual fields. Everything outside is kind of hazy, black, dark. So for that reason, she could only see a very narrow field and got into the car accident. Surgery is rarely necessary for a prolactinoma. Even if it's a very large prolactinoma, you can actually treat it with dopamine agonists. The only time that you use surgery is if the dopamine agonists fail or they have some reason that they cannot take the dopamine agonists. I hope you found this case very useful, and come back next week for another one.